Here are the top 10 reasons for visits to the Seattle Children's Emergency Department. Number 10, a rash. 9, laceration, which is a cut or gash. Number 8, otitis media, a middle ear infection. Number 7, a broken bone. 6, asthma. 5, abdominal pain. The fourth most common reason for an ER visit to Seattle Children's, a soft tissue injury like a bruise, sprain, or strain. Number 3, upper respiratory infection. Number 2, gastroenteritis, a stomach virus. And the number 1 reason for an ER visit to Seattle Children's, fever. You can see from that top 10 list that many of the things that bring children here are certainly concerning, but not that high adrenaline life and death situation that Hollywood portrays. Fortunately, those situations don't happen often, but they do happen. That's why everyone here has to be ready for the big one at all times. Tune in to any hospital TV show and you'd think emergency rooms are constantly bringing people back from the brink. But that kind of excitement is more about ratings than real life.
We know when you watch ER on TV or other shows, everything is really acute and emergent. And I think when we look at our patients, most ERs don't have that high level of acuity and emergency. So we might have 1 or 2% of our patients per year that need a full-blown resuscitation. But we have to be ready for that any time of day or night for any cause, whether it's a trauma cause, whether it's a medical cause, whether it's a cardiac cause, a drowning or anything else. We have to be ready for that.
So Ronnie, we're in the ED. Airlift has just transferred her over. She's already on monitors. She's got a working IV.
Ready for anything at any time. That's why training, and lots of it, is so important.
Patient weighs 12.5 kilograms and has no drug allergies.
Teams run scenarios complete with role-playing, sometimes with scripts to follow, to fine-tune communication.
So we just did a scenario, which in our terms is simulation. That's practice. We're practicing. It's an opportunity for us to work on skills and on communication challenges that we face every day. And it's a chance for us to work on them and practice them over and over again so our skills get better and our processes run smoother.
Can I get a doctor in here?
Some simulation training is so realistic, it's hard to tell it isn't the real thing.
Total of 10 milligrams, is that correct?
Correct.
As this team tries to deal with a resuscitation drill, a technician makes the sim baby's breathing, blood pressure, and heartbeat react as a real baby's might.
So Sarah, after you've gotten the intubation meds ready, then we'll start a bolus.
The sats are still dropping and I'm struggling to ventilate.
The staff at Seattle Children's are national leaders in developing and implementing simulation training like this.
So right now they're getting ready to intubate the patient. They're going to be giving rapid sequence medications.
So this is epinephrine, 1.1 milligrams.
They set the standard for how providers across the country train and prepare.
Let's stop the scenario.
With practice, this kind of emergency becomes routine, even though it's relatively rare, as appropriate and immediate response can be life-saving.
And it's probably similar to what pilots do. You know, they practice and they practice and they practice, so when they have an emergency, it's second nature. And one of the most important things in the emergency department is to anticipate and be prepared.
Of the nearly 40,000 emergency room visits to Seattle Children's last year, a good number of those were for things that could have been prevented. No offense, but when it comes right down to it, doctors would rather not see you here. Not if taking their advice can keep your child safe and healthy. Ben Franklin once said an ounce of prevention is worth a pound of cure. That sentiment rings true every day here at the emergency department at Seattle Children's. Any parent here would love to turn back time. Anything to have avoided this visit in the first place. Anything to keep their child safe.
Hi, I'm Dr. Ben Danielson, a pediatrician at Seattle Children's Hospital. I'd like to talk with you a little bit today about pedestrian safety.
Doctors at Seattle Children's want kids to avoid ER visits just as much as parents do. That's why they take the time to star in public service announcements over the airwaves and on websites to share important and specific safety information.
There's no question that the best way to protect your child when they're on a bike, a scooter, or skates is to wear an appropriately sized helmet.
They give tips, reminders, and advice that might keep them from seeing your child in the emergency room.
Wear a life jacket.
As ER docs, they'd love nothing more than to put themselves out of business, to never be needed again.
Each year, almost 5,000 children nationwide fall out of windows.
Such simple things as an open window at home or a hard hit at practice can turn an ordinary day into an emergency situation.
Make sure your child has the right safety gear and that it fits properly.
In an instant.
Those safety caps only work for so long.
Accidental poisonings send 50,000 children to the hospital every year nationwide.
I'm Dr. Suzanne Mazer, an emergency room doctor.
Dr. Suzanne Mazer sees an average of 3 or 4 cases in the Seattle Children's ER each week. Kids who've gotten into prescription pills or household cleaners because parents didn't take steps to keep them out of the hands and mouths of babes.
2/3 of kids who are poisoned are kids less than age 5, and almost all of those are preventable. So an unsupervised kid getting into a medicine, just for a minute, the parent looks away and the child gets into a medicine.
Seattle Children's also hosts community events, educating and equipping families to keep kids safe.
This one you try on.
Outreach events, such as this one at Green Lake, offer bike helmets and life jackets at low prices and properly fitted in hopes they'll get used and potentially save lives.
I think it's cool that they offer life jackets, since it should be required, definitely.
I think it's a great, excellent program, and I think everybody should take advantage of it.
The outreach, the education.
First, insist on adult supervision.
All of these ounces of prevention can add up and make a weighty difference.
Learn to swim.
Drownings, for instance, have dramatically decreased in the past few decades since Dr. Linda Kwan made it her mission to help stop such preventable tragedies.
We have worked really hard by trying to get families aware of the risks, and we've worked hard with the health department. They've been amazing leaders in this with us, partners with us, and we've worked to get legislation passed to make children safer, like wearing life jackets. And the health department has worked to have legislation to make our pools safer. And so all of this has contributed to, I believe, the reason why we're seeing so few drownings.
The ER at Seattle Children's is here when you need it.
You should wear a helmet too. Kids are more likely to wear a helmet if their parents do.
But hey, if you can avoid ever having to come here, even better.
Absolutely, prevention is the name of the game.
Seattle Children's has compiled many safety and wellness tips for parents and caregivers. If you'd like to learn more, go to seattlechildrens.org/safety-wellness. Sadly, not all emergency room visits are the result of accidental injury or illness. Abuse is a reason for a small percentage of pediatric ER visits. Again, prevention is key. When it comes to abuse, prevention begins very early and with education. A crying baby, an exhausted parent. This is the time a child is most at risk of abuse.
The peak age at which it occurs is somewhere around 2 to 4 months of age, and that coincides with the time when babies are crying the most. If you look at a large population of babies, there's big criers and there are little criers, but they always start low about 2 to 4 months that they're at the peak, and then it falls off after that. And it's right around the time when babies are most fussy and most crying that the injuries tend to occur. A lot of times in the history, particularly if there's a confession, you learn that it was inconsolable crying that led to the events.
I couldn't make him stop crying. So I got frustrated. I felt like the worst mom on the planet. I felt like maybe I had a bad baby.
This is a video produced by the National Center on Shaken Baby Syndrome. As part of a statewide program to prevent abuse, many birthing hospitals in Washington are now giving these DVDs to new parents, telling them it's normal for babies to cry, sometimes inconsolably, and giving them ways to cope when that happens.
It's okay to be frustrated. It's what you do when you get frustrated.
I think anybody who's been a parent of an infant and is being honest will tell you they hit a point when they were extremely frustrated and even angry with the baby. And We want parents to know that's going to happen. They're not bad parents because of that, but they have to be able to react in a way that won't injure the baby.
As past medical director of Seattle Children's Protection Program and a former emergency room physician here, Dr. Kenneth Feldman says ER teams are trained to look for signs of abuse, especially in babies.
So often we see a bruised infant at an age when they're not mobile enough to bruise themselves, or we see tears in the mouth. And if we look closely with X-ray, we'll often see broken bones elsewhere in the body.
Even one abuse case is one too many, but a few years ago, the number of cases spiked.
We thought we were seeing about 1.5 a month between Children's and Harborview, which are the two institutions that get the majority of these kids in the central Puget Sound area. In 2008, we saw a major jump to the mid-30s associated with the onset of the recession. And then over the last couple years, it settled down to where we're seeing in the mid-20s a year.
There are a number of reasons why shaking is so dangerous.
Through the DVD and educational pamphlets, it's hoped parents will understand that crying is a normal phase of development for an infant, and that they'll make a plan for dealing with it in a way that's safe for their baby. The main tip for parents dealing with a crying baby, after ruling out that the baby needs to be fed, changed, or is in some sort of pain, put the baby in a safe place, such as a crib, for a few minutes while you take a break. The baby will be okay to cry it out for a little bit, and you'll feel better able to cope after a short time away. Coming up, when your child is hurt or sick, how do you decide whether to come here or go to an urgent care clinic? We'll have advice for parents. And later, come along on a journey on which you've probably never been, down deep to retrieve a swallowed coin. This is a rather frequent journey at Seattle Children's, and it's not just coins doctors remove. See the unique collection of things once swallowed, snorted, or stuck in ears.